And welcome back to House Calls. I'm Martin Folse. Joining us once again, Dr. Pat Hagen, who is an expert in ear, nose, throat, and sinus. And Doc, we've talked a lot about sinusitis and removing polyps and everything else, but now I think you can actually show us a procedure,
Yes.
right?
Yes, we have a videotape of the microdebrider actually removing a polyp. And what we're seeing now as the tape is moving is the cannula advancing up on the polyp. The suction is sucking the polyp into the cannula, and the tissue that's being removed is being removed inside the cannula. Therefore, it's being done safely by a serrated blade that is essentially shaving the polyp into smaller pieces so that it can be suctioned and removed. And as you can see, as the videotape moves through the procedure, you can follow the polyp back to where it came from, back to its origin, and reminding yourself that as we're doing this, the brain is at the top of the screen, the eyes are off to the side, because that makes up those walls of the sinuses. So it's crucial to be able to remove these things with very little oozing.
Yeah, tight quarters, I guess.
Oh, yes, sir. But with the technology we have today, there's a higher margin of safety.
Once again, very interesting. Glad you shared that video with us. In weeks to come, we'll talk more about it. Dr. Pat Hagen, once again, our expert in ear, nose, throat, and sinus.